The Ihangane Project is a non-governmental organization that is reimagining the way that healthcare is provided and received around the world. Our mission is to empower local communities to develop effective, patient-centered, and sustainable healthcare delivery systems that holistically respond to the needs of vulnerable populations. We began working in Ruli, Rwanda with the goal of improving health status of HIV-positive adults and children. Our work has evolved into a surprisingly simple, highly effective model for delivering healthcare to vulnerable people. The Nutrition for HIV-Exposed Infants clinical program seeks to improve the quality of healthcare delivery and prevent both HIV transmission and malnutrition amongst children under 2. It takes a holistic approach to addressing the complex needs of families affected by HIV. There are 2 main components of NHI: health screening of children for malnutrition and HIV, as well as the provision of fortified porridge for the families. The participants of the NHI program are also referred to the farming cooperatives and artisan groups as a means of sustaining good health outcomes achieved in the clinical program. The Ihangane Project approached HIV-positive farmers throughout the region to establish farming cooperatives. We agreed to provide the cost of land for the cooperatives. In exchange, farmers agreed to repay 15% of the costs into a reinvestment fund for the cooperatives and to donate a portion of the grain production to the Ihangane Project for local fortified porridge production. These cooperatives increase food security for all HIV-affected families by increasing access to nutritious food, providing a source of income generation, as well as grains to locally produce fortified porridge for the NHI program. Our organization supports the cooperatives by providing nutrition and development trainings on sustainable agriculture, composting, agroforestry, rotating crops, kitchen gardens, and poverty versus development mindset. As women and children graduate from NHI, they are encouraged to join the Community-Based Nutrition Program, a village-level program overseen by community health workers. It is designed for prevention and early diagnosis of malnutrition amongst all children under 5 years old. The Ihangane Project strengthens the program by providing health and nutrition trainings for community health workers and supports the community to build fully equipped shelters where community health workers can then effectively provide nutrition education and culinary demonstrations. The trainings also happen at the health center and village level. All nurses and community health workers hold an educational session each month for the NHI and community-based nutrition program participants that follow the Ihangane Project education model. This model follows the idea to see, say, do, teach, and brainstorm that assists mothers to better understand how each session, like having a balanced meal, can be part of their daily life. The goal is to change the health behavior of participants, thus empowering them to live a healthier life. The NHI program has been extremely successful. However, the program did not have a reliable source of nutritional support, and we found that continuing to purchase fortified porridge was too expensive. As a solution to that challenge, we developed the Fortified Porridge Production Project, which will provide income generation opportunities for the farming cooperatives, and more importantly, fortified porridge to families in the NHI program and others in the greater Rwanda. Through our integrated programming that begins in the clinic, expands to the food supply, and returns to the clinic through fortified porridge, we are able to reach the entire target population of HIV-affected children, men, and women in the catchment area of Ruli District Hospital. Our programming prevents both malnutrition amongst children under 24 months and HIV transmission from mother to child through appropriate clinical management, provides home and community food security, and creates an opportunity for program sustainability through local production of fortified porridge. Our work has become intimately interwoven with the community we are working with. The interventions are considered key strategies for overcoming HIV and malnutrition. The community, as well as local and regional leaders, view as equal partners in these efforts. Our goal is to strengthen existing systems and empower communities to help themselves, initially challenging because the community was accustomed to traditional aid. They now embrace the concept of ownership and believe that they are able to identify and resolve the challenges they face. The Ihangane Project aided my children and myself by improving our health and furthering our socio-economic status. More importantly, the organization helped those of us with HIV/AIDS to shed our fear of stigma and empowered us to become independent. We are now able to live a longer life.